So welcome to one more important class in pharmacology discussion. So e class of now very important method which is very ನೀವು ನೋಡಿರಬಹುದು ಇದನ್ನ IV fluid ಆಮೇಲೆ electrolyte imbalance ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಕೇಳಿರಬಹುದು, ಡಿಹೈಡ್ರೇಷನ್ ಬಗ್ಗೆ ಕೇಳಿರಬಹುದು, ಜನರಲ್ ನಾನ್ ಲೇಮನ್ ಟರ್ಮ್ ಒಳಗೆ ಸಲೈನ್ ಅಂತ ಏನು ಹೇಳ್ತಾರೆ ಅದ್ರ ಬಗ್ಗೆ ಕೇಳಿರಬಹುದು. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಲೈಫ್ ಸೇವಿಂಗ್ ಮೆಥಡ್ ಆಫ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್. ಸೊ ಇದ್ರ ಬಗ್ಗೆ ನಾವು ಡಿಸ್ಕಸ್ ಮಾಡ್ತೀವಿ. ಸೊ ಮಾಡೋಣ ಇವತ್ತು ಡಿಸ್ಕಸ್ ಮಾಡೋಣ ಏನಂದ್ರೆ ಎಲ್ಲಿ ಯಾವ ಟೈಪ್ಸ್ ಆಫ್ IV ಫ್ಲೂಯಿಡ್ಸ್ ನೀವು ಇದ್ರ ಬಗ್ಗೆ ಕೇಳಿರ್ಬೋದು. ಸೊ ಏನು ಅದ್ರ ನಡುವೆ ಇರುವಂಥ ಡಿಫ್ರೆನ್ಸಸ್ ಏನು, ಎಲ್ಲಿ ಯೂಸ್ ಮಾಡ್ತೀವಿ, ಅದರ್ ಎನಿ ಕಾಂಟ್ರಾ ಇಂಡಿಕೇಶನ್ಸ್ ಫಾರ್ ದೇರ್ ಯೂಸ್, ಎನಿ ಅಡ್ವರ್ಸ್ ಎಫೆಕ್ಟ್ಸ್ ಅದ್ರ ಬಗ್ಗೆ ನೋಡೋಣ. ಆಮೇಲೆ ಕಾಮನ್ಲಿ ಸೀನ್ ಎಲೆಕ್ಟ್ರೋಲೈಟ್ ಇಂಬ್ಯಾಲೆನ್ಸಸ್ ಬಗ್ಗೆ ಬ್ರೀಫ್ಲಿ ನಾವು ಡಿಸ್ಕಸ್ ಮಾಡೋಣ. ಲೆಟ್ಸ್ ಸಿ ಅಂಡ್ ಟ್ರೈ ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ದಿಸ್ ಕಾನ್ಸೆಪ್ಟ್. Yes, IV therapy andre intravenous therapy. It is an effective and efficient method of supplying fluids directly to intravenous fluid compartment. So directly we are going to inject. So bioavailability will be 100%. Amele very effectively there will be change. There will be increase in the volume. They are also known as plasma expanders. Andre plasma na yen martade will expand. Adra opposite andre contraction. Yava contract agirta if there is loss, whether it is because of dehydration or hemorrhage, whatever it is, there will be contraction. These drugs will expand it, so they are known as plasma expanders. Very important drugs. So IV now kodbekandra there are three ways by which you can give a drug, that is IV injection, bolus, amele ಇನ್ನೊಂದು ಏನಂದ್ರೆ fluid replacement therapy. So normal injection ಕೊಡಬಹುದು, ಆಮೇಲೆ ನೀವು ನಾವು ಕಾಮನ್ಲಿ ನೋಡಿದ್ರೆ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಆಂಟಿಬಯೋಟಿಕ್ಸ್ ವೆದರ್ ದೇ ಆರ್ ಇನ್ ದ ಫಾರ್ಮ್ ಆಫ್ ಪೌಡರ್ ಆರ್ ಲಿಕ್ವಿಡ್ ಅದನ್ನ ಬ್ರೇಕ್ ಮಾಡಿ ಡೈರೆಕ್ಟ್ ಇಂಜೆಕ್ಷನ್ ಕೊಡಬಹುದು. ಅಂಡ್ ದೇರ್ ಇಸ್ ಒನ್ ಮೋರ್ ರೂಟ್ ದಟ್ ಈಸ್ IV, ದಟ್ ಈಸ್ ಫ್ಲೂಯಿಡ್ ರಿಪ್ಲೇಸ್ಮೆಂಟ್. ಅಂದ್ರೆ ಫ್ಲೂಯಿಡ್ ಲಾಸ್ ಆಗಿರೋದ್ರಿಂದ ಯು ಆರ್ ಗೋಯಿಂಗ್ ಟು ರಿಪ್ಲೇಸ್ ದ ಲಾಸ್ಟ್ ಫ್ಲೂಯಿಡ್ ಫ್ರಮ್ ದ ಬಾಡಿ, ದಟ್ ಈಸ್ by with help of many IV fluids. So you can replace large amount of fluid which is lost. So basic ಏನು ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕಂದ್ರೆ, so don't get confused, very simple concept. ನೀವು ಇದನ್ನ ಈಸಿಲಿ ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕಂದ್ರೆ ಏನು ನೆನ್ಪಿಟ್ಕೋಬೇಕಂದ್ರೆ, ನಾವೇನೇ ಯಾವುದೇ ವಾಲ್ಯೂಮ್ ಲಾಸ್ ಆಯ್ತಂತ ಅಂದ್ರೆ ಅಥವಾ ಹೆಮರೇಜ್ ಅಂದ್ರೆ ದೇರ್ ಇಸ್ ಲಾಸ್ ಆಫ್ ಬ್ಲಡ್, ಎಸ್ ಅಫ್ಕೋರ್ಸ್ ಇಟ್ ಕಂಟೇನ್ಸ್ ಪ್ಲಾಸ್ಮಾ ಎಲ್ಲ. ಬಟ್ ಸೇ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಡಿಹೈಡ್ರೇಷನ್ ನಾವೇನಾದ್ರು ತಗೊಂಡ್ರೆ, ಪರ್ಸನ್ ಇಸ್ ಹ್ಯಾವಿಂಗ್ ಡಿಹೈಡ್ರೇಷನ್ ಬಿಕಾಸ್ ಆಫ್ ಡಯರಿಯಾ, ವಾಮಿಟಿಂಗ್ ಏನೇ ಆಗಲಿ. ಸೊ ಒನ್ ಥಿಂಗ್ ಹ್ಯಾವ್ ಟು ರಿಮೆಂಬರ್ ಹಿಯರ್ ಇಸ್ ದೇರ್ ಇಸ್ ಓನ್ಲಿ ನಾಟ್ ಲಾಸ್ ಆಫ್ ವಾಟರ್ ಕಂಟೆಂಟ್ ಅಷ್ಟೇ ಲಾಸ್ ಇರಲ್ಲ, ದೇರ್ ಇಸ್ ಲಾಸ್ ಆಫ್ electrolytes that you have to understand. Electrolytes ಯಾವ ಕಾಮನ್ಲಿ ನಮ್ಗೆ ಗೊತ್ತಿರೋದು ಸೋಡಿಯಂ, ಪೊಟ್ಯಾಷಿಯಂ, ಬೈಕಾರ್ಬೊನೇಟ್, ಕ್ಲೋರೈಡ್, example, etc. So what are their functions? They have wide variety of function. So now pharmacology discuss ಮಾಡೋಕೆ we have discussed every electrolyte has very important function, whether it is to generate impulse, nerve muscle contraction ಆಗಿರಬಹುದು, ಆಮೇಲೆ to maintain the tonicity. When we are talking about shock ಬಗ್ಗೆ ಮಾತಾಡಬೇಕಾದ್ರೆ to maintain the pressure. So pressure maintain ಮಾಡಬೇಕಾದ್ರೆ the electrolytes, they are very important. So based on this fact, so if for example in ಯಾವುದೇ ಕೇಸ್ ಒಳಗ hypovolemia, for example shock ಅಂತ ಏನಾದ್ರು, shock ಅಂದ್ರೆ ಏನಾಗಿರುತ್ತೆ, body is not able to meet the demand of different organs or tissue. So ಯಾವುದೇ ಆರ್ಗನ್ ಗೆ ಬ್ಲಡ್ ರೀಚ್ ಆಗಬೇಕಂದ್ರೆ it should flow with a specific pressure. ಆ ಪ್ರೆಷರ್ ನ ಎಲ್ಲಿಂದ ಜನರೇಟ್ ಆಗುತ್ತೆ ಅಂದ್ರೆ ಒಂದು ಹಾರ್ಟ್ ಇಂದ ಜನರೇಟ್ ಆಗುತ್ತೆ ಪಂಪ್ ಮಾಡಬೇಕಾದ್ರೆ. ಆಮೇಲೆ electrolytes, they maintain the tonicity. So shock ಒಳಗ say for example in hypovolemic shock there is loss of volume, so now we will replace the volume and we also replace with electrolytes. Now this is basic principle by which we are going to administer these drugs. Okay, so we are going to use them. See ನಿಮ್ಮ exam ಒಳಗೆ ಬರಬಹುದು, very important question, again expected question. Classify IV fluids ಅಂತ. ಸೊ IV fluids ಬಂದ್ರೆ classify as crystalloids and colloids. ಯಾವ್ದೇ ಬಂದ್ರೆ there will be uses. ಸೊ uses ಬಂದ್ರೆ ಡಿಹೈಡ್ರೇಷನ್ ಬರ್ಬಿಡ್ಬೇಡ್ರಿ, ಶಾಕ್ ಅಂತ ಬರಿಬೇಡ್ರಿ, there are specific indications. So you can use this, write it down and write this will strengthen your answer. ಸುಮ್ಮನೆ ಒಂದೇ ಲೈನ್ ಒಳಗೆ ನೀವು ಶಾಕ್ ಅಂತ ಬರ್ಬಿಟ್ರೆ you are losing many important points. So dehydration ಅಂತ ಬರೆದ್ರೆ tell different types of dehydration. Severe vomiting, for example infective conditions, non-infective conditions, food poisoning ಆಗಿರ್ಬೋದು. ನೆಕ್ಸ್ಟ್ ಎಕ್ಸೆಸಿವ್ ಡಯರಿಯಾ, ಇನ್ಫೆಕ್ಟಿವ್, ನಾನ್ ಇನ್ಫೆಕ್ಟಿವ್, ಬರೀ ಆರ್ಗಾನಿಸಮ್ಸ್ ಗೊತ್ತಿದ್ರೆ ಆರ್ಗಾನಿಸಮ್ಸ್ ಬರೀರಿ, ಫುಡ್ ಪಾಯ್ಸನಿಂಗ್ ಅಂತ ಬರೀರಿ. ಸೊ ಕಾಮನ್ ಇಂಡಿಕೇಶನ್ಸ್ ಲೈಕ್ ಇನ್ ಎಮರ್ಜೆನ್ಸಿ ಕಂಡೀಷನ್ ಲೈಕ್ ಕೋಮಾ, ಅನಸ್ಥೀಶಿಯಾ ಕೊಡಬೇಕಾದ್ರೆ, ಡ್ಯೂರಿಂಗ್ ಸರ್ಜರಿ, ಪೋಸ್ಟ್ ಸರ್ಜರಿ, ಡಿಹೈಡ್ರೇಷನ್ ಆದಾಗ, ಹೈಪೋಗ್ಲೈಸಿಮಿ ಅಂದರೆ ಗ್ಲೂಕೋಸ್ ಕಂಟೆಂಟ್ ಕಡಿಮೆ ಆದಾಗ, they are used. So ನೋಡಿರಬಹುದು antibiotics powder form ಆಗಿದ್ದಾಗ you take IV fluids mix ಮಾಡಿ injection ಕೊಡ್ತಾರೆ. That is one. Chemotherapy agents use ಮಾಡ್ತೀವಿ. There is something known as total parenteral nutrition, ಅಲ್ಲಿ use ಮಾಡ್ತೀವಿ. And some critical conditions like anaphylaxis, status asthmaticus, status epilepticus, cardiac arrest, shocks. So illela there are wide variety of uses. Advantage ಏನಂದ್ರೆ accurate, controlled and predictable way of administration. So ನೀವು ಎಷ್ಟು ಅಮೌಂಟ್ ಕೊಡಕತ್ತೀರಿ, ಎಷ್ಟು ml ಕೊಡಕತ್ತೀರಿ, ಏನು tonicity produce ಮಾಡುತ್ತಾ, so it is predictable. Immediate response, very important. Why we are using in emergency condition. Immediate response is seen. Prompt correction of fluid loss. Disadvantages, yes, you have to maintain asepsis throughout the procedure. So ನೀವು asepsis maintain ಮಾಡಬೇಕು, patient end ಇಂದನೂ asepsis ಮಾಡಬೇಕು. Otherwise there will be complications like air embolism, thrombophlebitis cause ಮಾಡಬಹುದು. ಆಮೇಲೆ other infections ನೀವೇ introduce ಮಾಡಬಹುದು. So you should be very careful. Where should not avoid? So excessive fluid ಕೊಡಕತ್ತೀರಿ, excessive fluid ಇದ್ರೆ ಯಾವ organs directly affect ಆಗುತ್ತೆ. One is heart, one is kidney. So heart ಆಮೇಲೆ kidney related conditions it is avoided. Example, in congestive heart failure, hypertension, pulmonary edema, ಆಮೇಲೆ renal failure, renal conditions ಇರಬೇಕಾದ್ರೆ we are going to avoid. But we will use these IV fluids in these condition with specific calculations. So ಇದು ಯೂಸ್ ಮಾಡೋದು ಇಲ್ಲ ಅಂತಲ್ಲ, specific indications ಇರ್ತಾವ, ಅವಾಗ calculate ಮಾಡಿ we are going to provide them. This is for your knowledge, but in exam you can write this. Yes, complications again I told, if you don't follow proper procedures, all this can be seen. Local hematoma formation agodu, phlebitis andre inflammation of the vein, you can introduce the infection itself and cause secondary problem. That is one important adverse effect. Chills usually are observed after giving IV fluids. Amele air embolism. Yes, classification of IV fluid, it is mainly divided into maintenance, replacement fluids, amele special fluids. This is one way of classification, very easy way of classification for you. What you should remember is crystalloids and colloids. So crystalloids andre ನೆನಪಿಟ್ಕೋರಿ, ನೀವು ನೋಡಿರಬಹುದು ಅವಾಗಲೇ. ಸೊ ಬಾಟಲ್ ನೀವೇನು ಜನರಲಿ ಲೇಮನ್ ಟರ್ಮ್ ಕರಿತೀವಲ್ಲ ಸಲೈನ್ ಅಂತ, ಫ್ರಮ್ ನೌ ಆನ್ವರ್ಡ್ಸ್ ನೀವು ಸ್ಪೆಸಿಫಿಕ್ಲಿ ಹೇಳಬೇಕು ನಾರ್ಮಲ್ ಸಲೈನ್, ರಿಂಗರ್ ಲ್ಯಾಕ್ಟೇಟ್, DNS ಅಂತ. ಸೊ ಅದನ್ನು ನೋಡಿದ್ರೆ ದಿಲ್ ಬಿ ಕ್ಲಿಯರ್. ದಟ್ ಮೀನ್ಸ್ the ingredient is completely dissolved in that, so that's why they are called as crystalloids. Colloids andrena, they are not completely mixed, so they will be suspended. They are known as colloids based on the appearance. So hing ನೆನಪಿಟ್ಕೋಬಹುದು ನೀವು. So crystalloids andre common use ಮಾಡೋ normal saline, dextrose normal saline, 5% dextrose, isolate preparations ಆಗಿರಬಹುದು, they are crystalloids. Colloids andre starch preparation, albumin preparation, we will see them. Okay, this is some basic detail. Yes, very important chart. So now next discussion ಏನು ಮಾಡ್ತೀವಿ ಅದರ ನಂತರ please do come back and see this slide and see the changes. So ನೋಡ್ರಿಲ್ಲ. So one important aspect, one more thing you should remember is, ನಾವು ಯಾವುದೇ IV fluid ನಾವು ಮಾತಾಡಬೇಕಾದ್ರೆ we talk about the tonicity, osmolarity. So osmolarity ಎಷ್ಟು ಪ್ರೊವೈಡ್ ಮಾಡುತ್ತದೆ ಅನ್ನೋದು very very important. So here these are the contribution. Normal saline for example ನೋಡ್ರಿಲ್ಲ ಏನೇನು ಕಾಂಟ್ರಿಬ್ಯೂಟ್ ಮಾಡುತ್ತದೆ, it is contributing sodium, it is contributing chloride. So dextrose is contributing dextrose, this is dextrose half normal saline. So ಎಲ್ಲದರದ್ದು we have to see the contents. Now please pay attention towards ringer lactate. This is nearly as physiological fluid as which is present. So you notice it provides sodium, it provides potassium, calcium, chloride, amele lactate. So this table is very very important to understand. So after discussion just come back and cross check what you understand with help of this table. Yes, first crystalloid is 5% dextrose. See name ಒಳಗೆ ಇರುತ್ತೆ, ಅವಾಗಲೇ I keep on telling in every class, pay attention to name. It is 5% dextrose ಅಂದ್ರೆ 50 gram is dissolved in 1 liter, so that the concentration will be 5%. So 5% dextrose, it contains very simple, very dextrose as step. So dextrose will provide only energy. It corrects dehydration, supplies energy. Most specific indication for that is in energy in starvation ಆಗಿರಬಹುದು, and very important in hypoglycemia, life saving drug in hypoglycemia. Yes, it is used in dehydration but along with other IV fluids. Okay, so prevention and treatment of dehydration, pre and post op fluid replacement, different drugs it base ಆಗುತ್ತಾ. ಆಮೇಲೆ in starvation it prevents ketosis by providing energy. So chronic starvation ಒಳಗೆ hypoglycemia ಒಳಗೆ that those are the first indications. Next is this. Yes, where you don't want to use, no, na starting ಹೇಳಿದಂಗೆ contraindications ಅಂದ್ರೆ conditions of heart and kidney we are not going to use them, but in fluids containing dextrose 5% dextrose agli DNS agli, one specific contraindication andre it should not be used in cerebral edema and neurosurgical procedure. Okay, and it should not be used to wash wounds. Adukandre wounds ge glucose ನೀವು provide ಮಾಡಿದ್ರೆ you are providing food for the growth of bacteria. Those are very specific to contraindication. Adu bitre acute ischemic stroke, hypovolemic shock you are not going to use because it is glucose idna, it will draw the fluid in the opposite direction. Very important point, very important concept you have to remember. We are going to use normal saline or ringer lactate in hypovolemic shock. So first nimage enadru kelidre always tell hypoglycemia, starvation. So ee specific indications heli. Next, as alternative or in combination with other IV fluids, and it can be used in some when you are giving other drugs like quinine for example kodbekare you can use because it causes hypoglycemia. So dose kotiville, rate of administration you can try to remember this. Next, normal saline ant navenantivi. Normal saline andre edukku andre that is isotonic saline. So its tonicity is similar to that of plasma, so that's why it is called as isotonic saline. 0.9% normal saline na ನಾವು isotonic saline ಅಥವಾ normal saline ಅಂತೀವಿ. ಸೊ ಏನ್ ಇರ್ತಿದ್ರಾಗ saline ಅಂದ್ರೆ ಪ್ಲೀಸ್ ರಿಮೆಂಬರ್ ಸೋಡಿಯಂ ಕ್ಲೋರೈಡ್ ಅಷ್ಟೇ. ಸೋಡಿಯಂ ಕ್ಲೋರೈಡ್ ಉಪ್ಪು ತಗೊಂಡು ನೀರು ಮಿಕ್ಸ್ ಮಾಡ್ತೀವಲ್ಲ ದಟ್ ಈಸ್ ಸೋಡಿಯಂ ಕ್ಲೋರೈಡ್. ಸೊ ಇದ್ರಾಗ ಏನ್ ಕಂಟೆಂಟ್ ಇರುತ್ತೆ ಸೋಡಿಯಂ ಪ್ಲಸ್ ಕ್ಲೋರೈಡ್, ಆಸ್ ಸಿಂಪಲ್ as that. Okay, so it provides sodium and chloride, corrects both water and electrolyte deficiency. So again the complication is same. Next, what are the uses? So indication water and salt depletion. So hypovolemic shock ಕೊಡಬಹುದು, moderate dehydration ಕೊಡಬಹುದು, alkalosis with dehydration ಕೊಡಬಹುದು, severe salt depletion and hyponatremia ಅಂದ್ರೆ it is providing sodium. So condition with hyponatremia you can give this. ಆಮೇಲೆ diabetic ketoacidosis ಒಳಗೆ initial fluid therapy ಒಳಗೆ ಕೊಡಬಹುದು, hyperglycemia, hypercalcemia ಇವೆಲ್ಲ these are all. And one more, irrigation, washing of body fluids, wounds, external wounds clean ಮಾಡ್ಬೇಕಾದ್ರೆ because they are already sterilized these can be used as to wash wounds. Normal saline can be used as to irrigate the eye ಒಳಗೆ ಏನಾದ್ರು foreign body ಹೋದ್ರೆ so ಅವಾಗ ಕ್ಲೀನ್ ಮಾಡಿದಾಗ you can use them. And vehicle for certain drug. Yes, DNS andre, so DNS, D is dextrose normal saline. Okay, so normal saline plus dextrose provide ಮಾಡುತ್ತಾ. So again you can guess. So if you know the contents you can easily guess. So dextrose normal saline andre glucose irutte, sodium irutte, chloride. So where you are going to use where there is depletion of sodium and chloride. So last indications ನಾವು ಏನು ಓದಿದ್ವಿ ಅದು plus 5% dextrose ಎರಡು ಸ್ಲೈಡ್ ನೀವು ಆಡ್ ಮಾಡಿದ್ರೆ that will be the explanation about DNS, as simple as that. Yes, next is very very important and very commonly used IV fluid, and I have told in the beginning this is nearly as physiological fluid as you can get. So ringer lactate will provide sodium, potassium, chloride, calcium and lactate. So these many it is providing. So it will provide osmolarity of 270. So this is very nearer to plasma and it is providing all these electrolytes. So see here, each 100 ml contains sodium lactate 320 mg, sodium chloride 600 mg, potassium chloride 40 and calcium chloride 27 mg. Also it will provide lactate. Lactate ಏನು ಮಾಡುತ್ತೆ ಅಂದ್ರೆ it will neutralize the acid. So many conditions, many shock, there may be acidosis. So alle it is going to neutralize that acidosis. Okay. So as I told, most physiological fluid rapidly expands the IV volume. Lactate metabolized in the liver to bicarbonate, which buffers the acid pH. Very important property about ringer lactate. Yes, where you can use very easily, it can be used in most of the conditions. So ಇದೆಲ್ಲ conditions use ಮಾಡಬಹುದು. So last slides of but one thing, it is not providing energy. So glucose illa ile. So hypoglycemia agli, starvation agli you cannot use. You can use this in correction of hypovolemia, fluid replacement in conditions like burns, diarrhea, vomiting, all those things, and specific condition known as diabetic ketoacidosis. Okay, acidosis irta, so there you can use diarrhea induced hypokalemia. So it is providing, remember this, sodium, potassium, chloride, calcium and lactate. So LLA deficiency irta, you are going to use this fluid. Yes, where you cannot use, one specific indication again here is because of the lactate you cannot use in liver disease, severe hypoxemia and shock. So alle ನೀವು hypoxia and shock ಒಳಗ you cannot use, and others are same, severe CHF, lactic acidosis, because of already there is presence of ringer lactate and the lactate irutte, so you cannot give them. And Addison's disease, vomiting or nasogastric tube induced alkalosis ಒಳಗ you cannot use. ನಿಮಗೆ ಇದು ಕಾಂಪ್ಲಿಕೇಟೆಡ್ ಆದರೆ ಡೋಂಟ್ ವರಿ, ನಾನು ಯಾವಾಗಲೇ ಸ್ಟಾರ್ಟಿಂಗ್ ಹೇಳ್ಬಿಟ್ಟು ನಿಮ್ಗೆ ಸಿಂಪಲ್ ನೆನ್ಪಿಟ್ಕೋಬೇಕಂದ್ರೆ ರೀನಲ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಲೈಕ್ ರೀನಲ್ ಫೇಲ್ಯೂರ್ ಅಥವಾ ಬೇರೆ ಏನಾದ್ರು ರೀನಲ್ ಕಂಡೀಷನ್ಸ್ ಆಗಲಿ, ಹೈಪರ್ ಟೆನ್ಷನ್, ಕಂಜೆಸ್ಟಿವ್ ಹಾರ್ಟ್ ಫೇಲ್ಯೂರ್, ಸೊ ಈ ಕಾಮನ್ ಕಂಡೀಷನ್ಸ್ ಬರ್ರಿ ನಿಮ್ಗೆ ಇದು ನೆನ್ಪಿಟ್ಕೊಳ್ಳೋಕ್ಕಾದ್ರೆ ವೆರಿ ಗುಡ್. ಇಫ್ ಯು ಕೆನಾಟ್ ರಿಮೆಂಬರ್, ಅಟ್ ಲೀಸ್ಟ್ ಮೆನ್ಷನ್ ದ ಬೇಸಿಕ್ contraindications. Yes, these are some of the preparations. Isolite, P, Amyl, E, so you can write them in theory. So very specific children pediatrics very commonly use ಮಾಡ್ತೀವಿ. So ನಿಮ್ಗೆ exam rarely they are asked, but you can make notes of this. So this is the calculation of dose. ಯಾ ಡೋಸ್ ಆಗ ಹೆಂಗ್ ಕೊಡ್ತೀವಿ, this ನಾವು ಕೊಡ್ಬೇಕಾದ್ರೆ this is very important. Based on this you do the calculation. Yes, this is the diagram ನೀವು commonly ನೋಡಿರುವಂತಹ crystalloids. This is normal saline, ringer lactate, 5% dextrose, DNS. Yes, next is colloids. Colloids andre, so navagale concept of osmolarity helide nimge. So the osmolarity is contributed mainly by plasma protein agli albumin, globulin, so ivella contribute ಮಾಡ್ತವೆ. So colloids andre, they are large molecular weight substances that remain in the intravascular compartment, thereby generating oncotic pressure ಅಂತ ನಾವೇನಂತೀವಲ್ಲ, it produces this. So because of this, why they are effective, ಎಷ್ಟು effective ಅಂದ್ರೆ, so 1 ml blood loss ಆದ್ರೆ you can give 1 ml colloid, so it is equivalent, but to correct the same thing you have to give 3 ml of crystalloids, so they are nearly 3 times more potent than crystalloids. So these are colloids. Yes, basic information, colloids ಬಗ್ಗೆ ನಿಮಗೆ ಬಹಳ ಕಡಿಮೆ ಕೇಳಬಹುದು. So ಒಂದು ಅಥವಾ ಎರಡು ನೆನಪು. So again, I am not discouraging you to read everything, I am telling you what basic you should read. So ishtar nenpitkondi go further, don't be discouraged to read. It's always best to read everything. Okay, so albumin will maintain the oncotic pressure, amele they are heat treated preparation. So this is the common property about all these colloids. So they have immunogenicity, andre they have chance to cause allergic reaction. So they are, albumin for example is heat treated preparation of albumin, contains 5%, 20, 25% commercially available. So idella rate of infusion, amele this is some more detail about albumin. So ನೆನ್ಪಿಟ್ಕೊಳ್ಳೋಕೆ ಬಂದ್ರೆ it's okay, otherwise just remember the indications and contraindications. So indications ಏನಂದ್ರೆ rapid volume expansion ಬೇಕಾದಾಗ, so plasma volume expansion in acute hypovolemic shock, suddenly it will cause change in the pressure. We saw it is they are very potent. Conditions like burns, severe hypoalbuminemia. So albuminemia no conditions, so you can give very commonly, for example in acute pancreatitis. Next, hypoproteinemia, specific indications like liver disease, diuretic resistance nephrotic syndrome. So illella you can give. Contraindication, severe anemia, cardiac failure, hypersensitivity reaction. Yes, because they are going to cause hypersensitivity reaction. So dextran, yes, try to remember some basic points about this. So again, two form dextran 70 ml, dextran 40 ಅಂತ ಬರುತ್ತಾ, they will effectively expand IV volume. ಆಮೇಲೆ they have specific points about them is antithrombotic, ಆಮೇಲೆ it inhibits platelet aggregation, very unique point about this. Improves microcirculatory flow. So ನಿಮ್ಗೆ ಗೊತ್ತಿರೋರಂಗೆ there are different vessel, so large vessel, small vessel, hange microcirculatory flow na it improves, very unique two features, that is antithrombotic and improvement in the microcirculatory. Yes, hypovolemic correction not use ಮಾಡಬಹುದು, because of its antithrombotic action can be used in prophylaxis of DVT, myocardial ischemia. So na ಹೇಳಿದೆ specific condition with special calculation. So all directly no kodala, there is specific indication. So we have to be very careful with calculation and dose. Okay. Yes, other preparations like gelatin polymer. So idin nenpitkobodu ನೀವು again common indications ನೆನ್ಪಿಟ್ಕೋರಿ. Rapid plasma volume expansion like any other colloid, volume preloading in regional anesthesia, ಆಮೇಲೆ priming of heart and lung machine. Specific indication ಇದು ಇವು ಮೂರದು. Okay, next we'll see electrolyte imbalance. So electrolyte imbalance ಒಳಗ ಅಥವಾ acid base imbalance ಅಂದ್ರೆ mainly two things. One is respiratory imbalance, metabolic imbalance. So ಎರಡೇ imbalance ಏನಂದ್ರೆ acidosis ಆಗ್ಬೋದು, alkalosis ಆಗ್ಬೋದು. So respiratory alkalosis, respiratory acidosis, metabolic acidosis, metabolic alkalosis. So ಇದನ್ನ ಹೆಂಗ್ ಟ್ರೀಟ್ ನಾವು ಅಂತ ಬೇಸಿಕ್ ನೋಡೋಣ. So respiratory imbalance ಹೋಗಿ affects carbonic acid concentration. Metabolic imbalance ಹೋಗಿ it affects base bicarbonate concentration ನ change ಆಗಿಲ್ಲ. First, respiratory acidosis. So respiratory acidosis is a clinical disorder. pH ಏನಾಗಿರುತ್ತೆ ಅಂದ್ರೆ it will be less than 7.5 and PCO2 ಜಾಸ್ತಿ ಆಗಿರುತ್ತೆ. These are characteristic feature of respiratory. Partial pressure of carbon dioxide ಜಾಸ್ತಿ ಆಗಿರುತ್ತೆ. That will be reflected in the pH which is on the lesser side. Okay, so partial pressure ಇಲ್ಲಿ ನೋಡ್ರಿ more than 42. ಏನ್ causes ಅಂದ್ರೆ see ನಿಮ್ಮ ಎಕ್ಸಾಮ್ ಆಗಿ ಏನ್ ಕೇಳಬಹುದು ಅಂದ್ರೆ metabolic imbalances and drugs used in them. So briefly you have to write respiratory acidosis, ಆಮೇಲೆ example. So ಇಲ್ಲಿ ಕೊಟ್ಟಿರುವಂತದ್ದು like elevated plasma level, elevated carbonic acid, acute pulmonary edema, atelectasis, impaired respiratory muscles. Again, so you have to remember them. Causes ಬರುದು, tell the treatment. So these are the clinical conditions. They are very nearly common to most of the electrolyte imbalance. Treatment is by improving the ventilation. Carbon dioxide ಜಾಸ್ತಿ ಆಗಿರುತ್ತೆ. Very less pharmacological agents are used here. So ಎದಕ್ಕೆ respiratory ಒಳಗೆ problem ಇದ್ರೆ first identify the cause. Whether it is because of bronchoconstriction, respiratory problem ಏನಾದ್ರೆ if it is bronchoconstriction, give bronchodilators like salbutamol. Identify the cause. ಆಮೇಲೆ give bronchodilators, or if it is secondary to infection, give antibiotics. ಆಮೇಲೆ there may be coagulation, cascade may be hyperactive, so give anticoagulants. It's very, so ಇದನ್ನ ನಾವು ಎದಕ್ಕೆ ಇಷ್ಟು ಬ್ರಾಡ್ ಆಗಿ ವೇಗವಾಗಿ ಬರ್ತೀವಿ ಅಂದ್ರೆ it depends on individual condition, so you cannot generalize. So these are the common agents which you are going to give. Okay, pulmonary hygiene measures ಅಂದ್ರೆ maintain oxygen inhalation start ಮಾಡಬಹುದು, ಆಮೇಲೆ mechanical ventilation. Okay, alkalosis ಅಂದ್ರೆ opposite, partial pressure of carbon dioxide reduce ಆಗಿರುತ್ತೆ, pH ಜಾಸ್ತಿ ಇರುತ್ತೆ. Yes, these are the causes. Respiratory alkalosis is always due to hyperventilation. Please remember this. Anxiety, condition like anxiety, hypoxemia, hypocapnia. So these are all conditions which cause respiratory alkalosis. Yes, lightheadedness. So these are clinical manifestations are nearly same, nearly common. They fall under common group of symptoms. So again, you will see this line. Identify the cause, treat it. Most common cause like anxiety idra, identify, give anxiolytic drug, counsel the patient, ask the patient to take deep breath. ಆಮೇಲೆ sedatives, hypnotics ಕೊಟ್ಟು relax the patient. Metabolic acidosis ಅಂದ್ರೆ clinical disturbance characterized by low pH, increased hydrogen ion, ಆಮೇಲೆ low plasma carbonate. So ಅಲ್ಲಿ ಏನಿತ್ತು, partial pressure of carbon dioxide was increased in acidosis. Here it is bicarbonate ion. So remember this. So acidosis ಅಂದ್ರೆ H+ ion ಜಾಸ್ತಿ ಆಗೈತೆ, less ಆಗಿದೆನೋ bicarbonate. So what you want to give, you have to give bicarbonate ion. That is the basis of treatment. Very simple, can be produced by gain of hydrogen ion or loss of bicarbonate. Okay, headache, confusion, drowsiness. So these are all clinical conditions, the clinical manifestation of metabolic acidosis. Diagnostic is this. So arterial blood gas analysis plays very important role here. Next, treatment is directed at correcting the metabolic defect. ಏನು cause ಮಾಡಕತ್ತೈತೆ identify, treat it. Drug which plays very important role here is sodium bicarbonate. Sodium bicarbonate is administered if the pH is less than 7.1. Very important. ಆಮೇಲೆ one more important point you have to keep in mind is serum potassium level should be carefully monitored. Next is metabolic alkalosis, which is characterized by high pH and high bicarbonate ions. So opposite of last condition. So there are specific conditions like vomiting and gastric suction which causes loss of hydrogen and chloride ion. This is causing alkalosis. Very specific indications, very specific conditions which are causing this, like pyloric stenosis. So the diagnosis it will become specific to these causes. Clinical manifestations like tingling of the finger and toes, dizziness, amele symptoms of hypocalcemia can be seen, amele ventricular disturbances. Yes, provide sufficient chloride, sodium chloride supplement ಮಾಡೋದು. ಆಮೇಲೆ sodium chloride ಇರುವಂತ fluids, ಯಾವ sodium chloride ಇರುವಂತ fluids, normal saline, ringer lactate, supplement those fluids. So basic thing ನೆನ್ಪಿಟ್ಕೊಂಡ್ಬಿಡ್ರಿ. acidosis ಇತ್ತಂದ್ರೆ you're going to use sodium bicarbonate if the pH is less than 7.1. otherwise respiratory ಇತ್ತಂದ್ರೆ acidosis ಇತ್ತಂದ್ರೆ try to correct the respiration. bronchoconstriction ಇದ್ರೆ you're going to give bronchodilators, oxygen inhalation, correct the condition which is causing the acidosis. For example, if it is infection, treat the infection, anticoagulants ಕೊಡಬಹುದು. ಆಮೇಲೆ metabolic acidosis ಇತ್ತಂದ್ರೆ if the pH is less than 7.1 give sodium bicarbonate. ಆಮೇಲೆ in metabolic alkalosis ಇದ್ದಾಗ you're going to give IV fluids which is rich in sodium and chloride. So basically this is main management ಅಂದ್ರೆ identify the cause which is causing this. Okay, so this point you have to remember and write this in your exam. So again, H2 receptor antagonist like cimetidine reduces the gastric hydrochloride, thereby decreasing the metabolic alkalosis associated with gastric suction. So specific indications are that you're going to give specific drugs. Okay, so this topic again ನೆನ್ಪಿಟ್ಕೋಬೇಕಂದ್ರೆ ನೀವು, what is dehydration? I told loss of water and electrolyte, bari water alla. So going to replace it, mild, moderate and severe and divide ಮಾಡ್ತೀವಿ ನಾವು. In mild and moderate, please remember one more very important life saving medication which has revolutionized in management of dehydration, that is oral rehydration salt or oral rehydration solution, ORS. That is mild to moderate, very important. ORS. In moderate to severe you are going to give IV fluids. We have studied ANN component and again I have reproduced it here. So idanna based on this you are going to use drugs. ಆಮೇಲೆ electrolyte imbalances ಅಂತ ಬಂದ್ರೆ basically acidosis and alkalosis. So common conditions ಏನು, so again I have summarized that. ಆಮೇಲೆ treatment ನಿಮಗೆ ಏನು questions ಕೇಳಬಹುದು ಅಂದ್ರೆ treatment of dehydration ಅಂತ ಕೇಳಬಹುದು, right? So 5 marks question, write it nicely, divide IV fluid, crystalloids and colloids. ಆಮೇಲೆ IV fluids they can ask specifically, mention the uses of ringer lactate, mention the uses of normal saline. So ಹಂಗೆ ಕೇಳಬಹುದು. There may be hyponatremia ಅಂತ ಬಂದ್ರೆ you are going to give normal saline or hypertonic saline. So then hypokalemia ಅಂದ್ರೆ you are going to give potassium supplementation, potassium chloride ಅಥವಾ ringer lactate ಕೊಡಬಹುದು. So I make use of IV fluid knowledge. ನಿಮಗೆ IV fluid knowledge ಐತಲ್ಲ, you are going to make use of it. So most important thing you have to remember is the components. It's very easy and ಬಹಳ component ಇಲ್ಲ ನೆನಪಿಟ್ಕೊಳ್ಳೋಕೆ. So basic component ನೆನಪಿಟ್ಕೊಂಡ್ರೆ you can understand and you can answer many of the questions which are asked in this topic.